One of our favorite topics this year in our seminars and also in our workshop, but primarily our seminars, is posture. I mean, I think we talk about posture regardless all the time, but I want to give you a little bit of insight and some clinical applications where you can really be respectful of the entire system when it comes to improving posture. So to have good posture, you need to have and posture and balance kind of run together. But you need to have a healthy integration between the visual system, the vestibular system, and the somatosensory system. Okay, so if you get a patient that doesn't have good posture, you want to look at all these systems. And I'm going to show you what I do to check them and what I do to address these problems. So on the visual side, we're going to talk a whole lot about that when we go over the app and all of its applications. We've already done some testing. We went through the bedside exam, and with the bedside exam, it gives you an idea of where the problems are. You may not necessarily know exactly what the actual cause or why the problem's there, but you know that it's there. Okay, so that's a really good start. And the bedside exam is one piece of what your entire exam should be, but it's something that you can do kind of quickly too sometimes if you just want to look at that one little aspect in your patient's presentation. So we'll look at the visual system a little bit later. I want to show you what we're going to do too with that somatosensory system. And in this area here, we're going to fit in the chiropractic adjustment. And I'm also going to show you some strategies too that are involving the vestibular system as well. So while we're standing here, let me just show you quickly. This is a great times 0 times 1 exercise that I love to do. I do those a lot with especially the patients that have lost the cervical curve. They don't have an ideal cervical curve. Maybe they have more of an anterior posture. It could be that the curve is good, but their head is postured more anteriorly. And this is a great strategy that helps to address that. Now, from a visual standpoint, saccades, pursuits, gaze stability exercise, all have been demonstrated to various studies to be beneficial for posture. Even Vergence exercises, I've done numerous times in clinic here. I'll have a patient that have especially an imbalance in the A to P plane. You do Vergence exercises, especially if they've got either a convergence insufficiency or divergence issue. You fix that problem and their balance improves, their posture improves. So that's important to not quickly kind of run by that. It's so valuable and important. And the cool thing is a lot of times I'll do a Vergence exercise as they're standing. I'll have them stand and then get on the pad, and it'll be better immediately. So that's another great little gem. So with this ball here, this is called an exerciser, and it does give you some feedback here. But what we're going to do is I'm going to have Skylar stand right here. So Skylar, your head is going to be right against the ball. And you want your feet to be slightly ahead so that you're leaning back into it some. Okay, perfect. Doesn't have to be a significant amount. Now, and I'll let you hold the ball there just so that you can be in control of that. Now, you can use just a cheap little ball, that has some give for home. I have patients buy them at Walmart and places like that. And basically, what we're going to do here is, let me just bring this down here so you don't have to hold it. Is that a little bit better?
Yep.
Okay. So I'm going to have Skylar look at my thumb here, and he can do this to himself. I mean, he can use his own thumb. Use your own thumb like that, because if they're going to do this at home, then they need to do it by themselves. Follow your thumb all the way up with your head and your eyes together. Okay? And then hold it right here and bring your head back down to neutral. Okay. And close your eyes, and you will repeat that. So go ahead and do it one more time. And then bring your head back down to center and close your eyes. Okay, good. You can step away. Okay, so the reason why we do this is because naturally I would want to check their balance first. And if I suspect that those posterior canal systems overactive, and it's very common. You're going to see more of that than anything else in your practice. Then this exercise is great. Now, we're combining an isotonic exercise where they're applying pressure with the head, engaging the extensor muscles, and they're extending the neck. You're actually reconditioning the muscles that maintain that healthy extension and C-shaped curve, lordotic curve in the neck. But while you're doing that exercise, you're also doing a time zero back to kind of calm down that overactive posterior canal. If these posteriors are overactive, you're going to want to shift your posture away from them. Okay, you have to have a postural response. So if we're calming them down by going back, and then we are activating the anterior canal system and its vestibular ocular reflex, by keeping the thumb up and you're looking up at it while your head comes down, now you're in this anterior canal position, and you're also suppressing the posteriors, because when the anteriors are activated, posteriors are again suppressed. So suppress posterior, while you're doing an isotonic exercise for your neck and reconditioning those neck muscles all in one. It's really amazing. It works really well. And again, patients love that too. So that's a great tool. Now we've done the Epley maneuver. Just imagine this. We've done the Epley maneuver. We've done the time 0 times 1 maneuver right after the Epley. We get up here. We do this neck conditioning exercise to improve the posture and muscle tone in the neck, and hopefully shift and improve that curvature. Now, what we could do, another quick little adjustment that is so powerful. Skylar, I'm going to have you stand with your back against the wall. Now this is, I had to give credit to Advanced Biostructural Correction technique here, the ABC technique. That's where it came from. It's a first rib adjustment, but you do it through the clavicle. And the way that it's taught, keep your shoulders all the way back like that, is you tissue pull up to the clavicle. And right near that that junction of the clavicle and the sternum. And what you want to do is maintain a tissue pull, and you're going to do a very firm contact like this. And it feels like a punch, but I've done this with even elderly women that have very poor posture, and they really love it. Now I'll show you how I do it most of the time, and it's not like this, because this is, I think for some people they don't like having that hit there, but I do it on my fingers, just like this. So I tissue pull up and I make the contact upwards, so it's inferior to superior. What I like to do, and you can do this on both sides, by the way, left and right. I like to use the arthrostem, and I'll put the arthrostem right on it, and I'll do it with inspiration. So go ahead and breathe in, and breathe out. Breathe in, breathe out. Breathe in, and breathe in. I'll do at least one time, but most of the time I like to do two. They both work, really. So, Skylar, go ahead and step away. Does that feel any different?
Yep.
Yep. Immediately, they'll feel straighter. Shoulders just pull straight back. It's so effective. And so, other adjustments that are great for posture, but also breathing, and I like to do those a lot. I'm going to go ahead and have you face this way. Just scoot down to your left a little bit. I like to do decompressive adjustment where we decompress the spine. Patients love it. It feels great. We're used to having all that compression, but it also helps with posture immediately. And it's a non-painful adjustment because you're pulling vertebrae away from each other, and facilitates breathing, posture. I like to do those a lot. So what I'll do is I'll just kind of scan the spine. I look for any areas that may be protruding or fixated. And I've got one right here, right in the middle. And what I like to do is have the patient bring their hands behind their neck and bring your elbows forward. Now I'm just going to have you slouch forward a little bit just to kind of bring out that area that I want to adjust. And relax your back. And I like to move them a little bit, just that kind of gets them to loosen up. And then I'm going to ask you to go ahead and look up towards the ceiling. Just like that. And we had a huge release there. The timing is everything here. I'm doing this as he's moving in extension, but I'm also doing it as soon as I feel like the muscles are relaxed. If I feel like he's fighting me, sometimes I have to do it while the patient remains in flexion. See, I think your initial balance test could be very helpful here, but I have some patients that have this posture and they're very, very stiff here. And if I get them to extend, it makes it worse. I can't get any release. But if I adjust them in neutral, it works better. And sometimes I have to adjust them while they're flexing or while they're extending. You just may have to kind of play around with that, but you may have to do one or the other. Now, another really powerful adjustment, and I see this a lot, and patients love this, is the T1. You'll often see, they'll complain of, some tension in here, right in this area. And you'll find as you palpate both sides of T1, one side may be a little bit more tense, and I'm feeling the right side right now. That right side is just clearly a little bit more tense. I can actually feel the TP, kind of sticking back on that side. And before I do an adjustment on that T1, I'm going to do an adjustment on the opposite side on that first and second rib area. So I'm going to get right under the clavicle. And so go ahead and turn around, face the camera. I'm going to adjust right here. So as I'm palpating those ribs, I can feel like that's standing out a little bit on the left. And before I adjust posterior on the right, I'm going to adjust anterior on the opposite side. Really, we're going to take out all that rotation. And it always makes the adjustment of the posterior T1 on the right a lot easier if I adjust the anterior first. So raise your arms like that. It's kind of like the rib adjustments that we learn. And those rib adjustments are done primarily to facilitate movement of the rib and breathing. Relax your arms. But this is really to take out that rotation in the thoracic cage. So relax your arms completely. And I'm going to have you take a deep breath in and breathe out. And now I'm going to have you breathe in and look up. Okay, very good. So we get good movement there. And then we're going to go to the table and adjust that T1 posterior. So we're going to adjust the T1 on the right side. And it's really important now that we've done all this work to get ready for an adjustment. We checked balance, we checked eye movements, we balanced out vestibular imbalances. We've done a little bit of an exercise to help, bring about some balance and muscle tone. So I'm about to do an adjustment. So I want to make sure that the position that he's in will really help me and assist me with this adjustment. So I'm going to have him bring his right arm just by his side so that it's neutral. There's the least amount of tension in here. I want to adjust that T1, and I really want to help him. I want all the help that I can get to do a really good job. So I'm going to use these pads to really bring that shoulder up a little bit. And that also make a big difference because when the shoulder rolls forward, it gets a little tighter in here. And there's a couple different ways you can do this. So I'm going to find that T1, that posterior T1, and you can use your thumb right on that transverse process near the body of the vertebrae, and I can just have him turn his head all the way over like this. Okay, and I can just, as I ask him to relax that right side, I can feel when that relaxation happens. I'm just going to apply a little bit of traction actually this way just to kind of decompress the spine and adjust directly with my thumb straight in. That's one way to do it. Another way to do it, and this is probably the one that I use the most, is I'm going to actually use just this part of my hand here and my finger, and I'm going to get in there because I really want to drive posterior a little bit more. I'm a big fan of that posterior line of drive. I feel like it's very effective and powerful, and I can get it better this way. So here I am, there's my T1. Just relax your neck. We're going to just bring it over like that. And relax that shoulder as best you can. Keep it real loose. And as I'm extending here, I'm kind of getting a feeling of, is he really relaxing? If he's not, I may actually just bring the head back to center and bring it back over. I may do that a few times because this kind of helps the patient know this is what we're doing. And relax that shoulder as best you can. And when I do my adjustment, I adjust down and in directly into the spine with a fair amount of P to A motion. And that went really well. We got a good movement there. So you can go ahead and come on up. And we'll just turn on your back, actually. So the next thing that'd be really great to show you is what we do for the sensory system. Part of what we just did with an adjustment, especially this T1 and taking out the rotation in the upper rib area, will change their posture immediately. They'll breathe better, they feel better. It's an immediate difference. But we also want to make sure that the sensory mapping system is accurate, because if it's not, then that's going to work against them in maintaining good posture and good balance and good movement. And so this is a really awesome strategy here where, as I initially want to test, I may just use a point localization test and say, Skylar, touch the spot that I touch here. And I'm looking for accuracy. And, you know, it's normal higher up in the arms to be a little bit off, you know, maybe the width of fingers. But I still want it to be as accurate as possible. Now, if we get down near the wrist or the hand and he's really missing, then we know we want to focus on it. Now, you may say, well, he went like this and then corrected, but he got it. You know, yeah, but these little corrections, those are positive signs. We want to make sure that he can go right to it fairly quickly. And if he's hesitating, or if he's touching and then correcting, those are all positive signs. And so what I'm going to do, there's actually a lot of different things you can do with this here. One option is you could just do tracing of the hand. So you could do tracing all around. You can use like a Q-tip or something like that. I'm using my finger right now. So you go all the way around like this, and then you go out. You go all the way out through each finger like this. I do this a lot with especially my autism cases because they're not able to respond properly. If I do some kind of point localization test with them, they don't know. You know, so this is fully passive. And then I'll do the other side as well. I'll run out through each finger like that. And I'll do each limb like that because all their maps are off with autism. But really in your regular patients, if these findings are off, you want to make sure you address it. Now, after I've done the sensory component, I want to do something for the proprioceptive system. You can do adjustments. You can do figure eights or circles. So what I can do here is I would initially start at the shoulder, and I'll do 10 of these. You can do 10 at the elbow, just circles or figure eights. You can do 10 at the wrist and each finger as well. And this feels good too. You know, the patient is kind of improving their connection with their body, their awareness of where each body part is through proprioceptive input and light touch sensory input as well. Now, another great way to do this, and we obviously would do that with every limb or just the ones that are involved. So a lot of times you may find that they all are involved, or it could just be one side of the body. It could just be the upper or lower body. Now, we can use the visual system to our advantage here. I didn't do that just now, but we can, and that's ideal. So another way to do this here, I'm going to have you sit, actually. Sit facing this way. And so what I would do here is I'll say, Skylar, close your eyes. And I'm going to touch part of your arm. Okay, and with your eyes closed, shift your eyes to the spot that I'm touching. Okay? And then open your eyes. Okay? And then close your eyes. And now touch the spot that I'm touching. Okay, and back to center. All right, so we could do that at multiple spots. Now, ideally, you want to position the head in a position so that he doesn't have to move it. Maybe I could bring the arm a little higher so that it'd be more doable for him, so that he's just moving the eyes. So when the eyes look at the spot that we make contact with, that I touched, he's making the best guess of where to move the eyes. And if he's wrong, when he opens his eyes, there will be a correction. You might be able to see it. But then you close your eyes, and then you want to touch it with eyes closed. So you're using the visual system, you're using the saccadic system, and you're using the motor sensory system as well. So you're kind of combining all those maps together. This is really probably the best strategy that you can do. And you can do that all the way through the arm. You can do that on both arms and both legs. And this is extremely effective. Now, for patients who've got, they've got neuropathy and they've got some sensory disturbances, those types of exercises where you're recruiting the visual system, the motor system, to help restore that sensory map, it can go a long way and can help them tremendously. Now, another thing that's really valuable, and sometimes they may just have stiffness, an ache or a pain, or they've had an injury, let's say in this case in the arm. And I have patients who maybe they have stiffness, and we did everything else we knew to do to bring that stiffness down, and it's not working. So one thing that works really well is sometimes what I'll do is I'll have you close your eyes, and I'm gonna draw a shape, okay, with your arm. Tell me which shape this is.
Circle.
Yeah, and actually go ahead and lay down on your back. It's a little bit easier laying down. Okay, so shapes are easier. Okay, shapes are easier. We can do numbers. Okay, so I could say, okay, Skylar, which number is this? Okay, tell me which number this is.
3.
Okay, we can do letters, and we can do that with the proximal joints. We can do that with the distal joints. We can do that with the fingers. We can do that with the hip, with the ankle, with the toes. So you can really do that depending on where the tension is. I've had situations where, patients feel like their knees are kind of buckling every once in a while. They're just not maintaining good stability, and it feels tight and stiff as a compensation. That's just one example. There's lots of examples. But really, any kind of situation that you're working through, you can apply this kind of strategy, and you'll be really impressed to see how incredibly effective it is. And you can position the patient in a different position. So if you're finding they've got a really tight anterior compartment, let's say the right thigh, you can turn on your left side. And instead of just stretching like your regular stretching, I'm going to stretch, but maybe I'll ask him what number or which shape am I doing, so what number is this, so I'm picking number 3 again. What number is this? This is number 8. So the cool thing about this is that it's not just the stretch, you're including the brain along with your therapy, and it's far more effective. Not only is it more effective, but it'll hold a lot longer too. So let's go to standing. I want to just show one other quick thing, and then we'll be good to go with some eye movement exercises. So this is a Belgao board, and I just want to show you what we can do with this and maybe spur a little bit of creativity in your mind too, as to how you can do adjustments, because how the patient is positioned can make a huge difference in how well they receive the adjustment. And so in this case, back to our scenario, and I'll say the most common scenario that you'll see in your practice is, that posterior overactive system. Those posterior canals are overactive. You have this posture that changes like this. And so I'll bring this down. And I'm going to have Skylar stand on it facing this way. So you're going to stand at the end there, on the front of it right here, like this. Yeah. Okay. So his feet are on the front, and it gives his brain the impression that he is being lifted or pushed forward. Okay. And the compensation is to engage extensors. Having patients do exercises like this is really great for posture, just like backward walking is. One cool thing that I like to do sometimes, I'll have patients bring their arms out and do circles like this in extension. So they're engaging the extensors of the upper body. They're doing complex motion with the arms. Okay, good, thank you. Maybe you can have your patient like this while you do some eye exercises as well, and that could be beneficial. But you can do this too while they're getting adjusted. You know, I talked about the clavicle adjustment, the SC adjustment earlier, which is really a first rib adjustment through the clavicle. You can do it this way. I can have them stand here, pull your shoulders back, and I can get those. I can do that standing decompressive adjustment like this while they're on here. So place your hands behind your neck, bring your elbows forward, relax your shoulders, and look up. Good. And so you can get creative with that, but I'm positioning him in a position to favor a change in posture while we're doing some of our other applications. Obviously, I'm doing this with patients that can handle that level of stimulation, so always be mindful of that. Okay, so I hope this is helpful for you. There's lots of little tricks like this that you can add in. I'm going to show you one more thing, and then we'll go ahead and move on with eye movements. So I just want to show you a clinical application that I used for a number of patients recently that have had complaints of neuropathy in their legs and their feet. And this has worked well, especially with the ones who complain more of tingling. And so what we do here is his feet are in the water, and I put a little bit of salt on each side just to improve conduction. And this device is made by Zetec, and I use the frequency of 9, and the intensity I just go up so that he can just barely feel it, just lightly feel it. And that's where he is right now. So I'm going to leave it just like that. And we're going to do that for about 15 minutes. But in this particular case, I had found in a patient that they had a left pons weakness or deficiency. So I found a soft lesion there. And I wanted to combine an eye strategy and also more direct stimulation to the pons on the left with this all at the same time. So this is how we did it. So I'm going to use, this is just an insufflation bulb, okay, attached to my otoscope. And I'm going to use insufflation on the left side here in his left ear. And this is thought to have an effect on at least 2 or 3 cranial nerves that we think of. You know, there's the cranial nerve 5. Potentially 9 and 10 are also affected there. So it's really great to activate, especially that left pons or that pontomedullary reticular formation on the left. So I'm going to do this on the left, and while we do that, we're also going to have him follow a moving target pursuit motion to the left. So when we pursuit to the left, we activate the left abducens nucleus, and this is a great pons stimulation as well. And it's really matches our findings. So I'm going to go ahead and do the insufflation at the same time. And I'm going to do this for the duration of, you know, whatever I determined was effective for this patient. In general, what I do is I'll match it to the eye movement. If I feel like maybe 10 repetition is ideal for the entire duration, I'll do the insufflation. And even if I only did a few sets of this and then stop, when I'm done, I'm going to stop the exercise, and I may let the patient continue to do you know, the stim and with their feet in the water there. The water is just a great conductor, and if we put the entire foot in there, instead of just putting little electrodes everywhere, we're getting the entire foot and lower leg stimulated. The effect on this can be, some people notice a difference immediately, some people notice it within days, but it's been really amazing. I mean, it's really surpassed my expectations. And if you combine, and this is really our objective here, we want to combine therapies together so that the entire system can work together a lot better. So I hope you find this helpful. There's other ways to address neuropathy. This is one thing that I've done and I thought that you might learn from and enjoy seeing.